So before, they used to treat double chin by tracting the skin upward. And we have to admit that double chin is a worldwide common concern affecting the aesthetic appearance of the neck and face. Double chin might affect anyone. It's a focal accumulation of fat leading to the submental convexity. So usually we try to hide the concavity that comes with aging in our face. And this is the opposite in the neck. We are trying to fight the convexity that occur with time. So related causes could be obesity, aging, lifestyle, and genetics. People with double chin always feel older, heavier, they try to hide it, and they feel sometimes depressed. Always remember that a youthful, attractive neck include a well-defined cervico-mental angle and a sharp, full mandibular contour. And this will be hidden by the blunt accumulation of fat in this area. Now, what do I do in my clinic when I face a case of double chin? I started this like 5 or 6 years ago. Usually, I use a grade from scale from 0 to 4. So first, I will see the grade of the double chin. Then I sit with my patient, I analyze, I talk, I explain to her what shall we do. Understanding the neck anatomy is very crucial and very important in order to reach the appropriate treatment plan and to select the appropriate patient for this procedure. Now, the three main features that determine the shape of the neck, first you have the muscles, the fat, and then the submandibular glands. For the fat, we have, as you see here, we have 3 layers of fat. We have the subcutaneous fat, then we have the fat that lies into the platysma or the interplatysmal fat, and the subplatysmal fat. My target in the non-invasive therapy, whether it was injectables or non-injectables, is to treat the subcutaneous fat. Then we have the muscles. We have the platysmal muscle. It's very important. The platysmal muscle actually extended, it's a pair of muscles extended from the clavicle up to the mandibular or the jawline. And then we have the submandibular glands. Some people do platysmoplasty, and here they cut the platysma to shorten it, to tighten the skin. This is a tricky operation. It needs a very skilled plastic surgeon for fear of injuring the submandibular branch of the mandibular nerve. Now, other treatments, what shall we do? We have the invasive therapy and the non-invasive therapy. The invasive therapy or the surgical therapy, we have the liposuction and other procedures like a neck lift, for instance. A liposuction, this is a very effective, very safe procedure, should be done by a skilled person, but again, you have to take care of a severe jawline. You might leave irregularities in the neck, or you might go to a serious complications like injuring the mandibular nerve and might cause some weakness of the lower lip muscles and the shape of the lip. Now, for laser-assisted lipolysis, there is a platform of too many laser machines. These machines did not prove any superiority to liposuction. And actually, they cannot stand alone for the treatment of liposuction in this area. And plus, they might cause thermal damage and irregularity in the neck itself. Now, surgery is excellent, but as my friend, the plastic surgeon Roger, mentioned once, Amar, he said that the best treatment for surgery is to cut the connection between the platysma and the facial muscles because they are connected. And then you do a transverse work rather than a vertical traction. So surgery is another option, but again, it lies with liposuction, and lots of people don't like to go to this option. Then you have the non-invasive other procedures like HIFO, radiofrequency cryolipolysis. Now, HIFO is painful, and again, HIFO, radiofrequency cryolipolysis, they lie in the gray zone area. So when your patient comes, you say, I'll do for you HIFO, he will leave without getting rid of the double chin. So you will tell him, come back after 6 months or 5 months, we have to repeat, he pays a lot of money. So this is a procedure that lies in the gray zone. Radiofrequency, whether it was monopolar like thermage or with microneedling, is a beautiful technique, but again, it lies in the gray zone area and it's a very expensive procedure. Then you have the cryolipolysis. It's a time consuming. We used it long time ago. Patients pay a lot of money. There are reports, and we saw actually cases of paradoxical hyperplasia with pain and numbness. Then we have the first FDA approved injectable drug that contours and improves this area. It was the deoxycholic acid. It's a fantastic treatment. The problem with this drug actually that you cannot inject except in this orange zone, because this treatment actually it kills and breaks the cell of the fat cell. So it breaks the cell membrane and it will cause necrosis. So it might cause edema, swelling, hematoma, pain, numbness, tissue necrosis, and usually it breaks the adipocyte. So you cannot go, for instance, in the face. You're only allowed to treat this area. Now, today I'm going to talk to you about the new hope in the treatment of double chin. That is the emergence of the recombinant enzymes of bacterial origin. These three enzymes, lipase, collagenase, and hyaluronidase. Together, this enzyme is an innovative approach that is effective and safe compared to alternative other procedures. So, what these enzymes do, they target a specific substrate. So, in case of lipase, for instance, it will target the triglycerides. It will reduce the size of the cell, so it will reduce the size of the double chin area. So, role of lipase in the adipose system is that it decreases the adipocyte volume. As we mentioned, it will digest the triglycerides with no tissue damage, and recombinant lipase is not sensitive to hormones, because you know that human lipase is very sensitive to the hormonal regulation of the body. For instance, with insulin, it inhibits the lipase after taking a meal. This recombinant lipase is not affected, so you can take it anytime with the same efficacy and safety. So then we have the collagenase. The collagenase, it will act against the old collagen and the malfunction collagen. So it will act in the malfunction collagen. Where can you find the malfunction collagen? In cellular. And after liposuction procedure, again, it will act on all collagen and in collagen in the scar tissue. So it will prevent scarring, it will improve cellulite, it will improve the lesions after the subcutaneous or the liposuction, and the most interesting thing, it will fight old collagen by promoting remodeling of this collagen, and it will act on fibroblasts to produce new collagen formation, so it will prevent and fight sagging of the skin. Someone will say, after injecting on my skin, there might be some sagging. Actually, collagenase will prevent this. Then, here we have to thank hyaluronidase. Hyaluronidase enzyme, it will degrade the polysaccharides that retain water. So it will drain all this excess water and promote the increase the permeability of the connective tissue and will pave the way for the other two enzymes, lipase and collagenase, to work on the target. So why do we apply the three enzymes together? We have, again, to remember that double chain is fat tissue surrounded with collagen and surrounded with polysaccharides and water. So the three enzymes, they have synergistic effect and they will work in a way to get rid of the fat, the water, and to remove the collagen. Why do I recommend the recombinant enzymes? Higher stability, higher purity. They go for a specific substrate like triglycerides in case of lipase, and usually they are safe than enzymes of different origin. So when you compare it with the oxalic acid, for instance, there is no cytolytic therapy, no tissue necrosis, and it's a very safe therapy. How would I do it? Usually you can find it in vials. So you add 4 ml of saline to each vial of the hyaluronidase, lipase, and collagenase. So you will have 12 cc of the this mixture. Then you add 1 cc of anesthesia to every lidocaine, to every vial. So you will have 15 cc, and then you will inject immediately into the desired area. In case of double chin, which I'm going to talk about today here in more in details, you will use 2 vials of lipase, 1 vial of collagenase, 1 vial of hyaluronidase. You will add 4 cc of saline and 1 cc of the lidocaine. Now, if you want to treat a specific area, like the jowl, for instance, you might make this mixture more concentrated. So you might add 1 cc of saline in each vial and half cc of the lidocaine. You inject multiple injections in the desired area. You can inject in the jawline, on the nerve, on the face, everywhere in the face. You can inject. You can inject today and after 2 weeks, and a third session, it could be after 1 month or 2 months. Now, the injection technique, retrograde with 30 gauge needle, 0.4 cc between each injection. So it's a very simple procedure. General recommendation, ask your patient not to go to public places where you might to get infection, like every other injectable precautions technique. With COVID vaccination, we ask our patient at that time to wait after the vaccine 15 days to be injected. So this is the enzymatic cocktail preparation, as I mentioned, and here I would like to show you some results. This is a patient after only 1 session, and here you can see the difference. This is only 1 session, or after 2 weeks improvement. Then this is another patient after 2 weeks, only 1 session of improvement. This is a marvelous result. This is a guy from Yemen. He came, he lives in Jordan. He did 5 sessions, and you can appreciate the great difference after 6 months and here after 5 sessions of treatment. In this patient, she came, she did lots of sessions, more than 4 sessions. That picture was before, after 2 weeks, after 6 weeks, after 3 months. This is what I call it the black and white result. I mean, when you do botulinum toxin, you will immediately get a nice effect after 1 week. And here, this is what we achieve after using this treatment. So I cannot compare this treatment, for instance, with HIFO, or I compare it with radiofrequency or with assisted lipolysis. It gives you immediately a good result, and the the best result here that this result is sustained after 1 year. You can see this lady after 1 year, she still have the good effect. So someone will say, will it come back? No, as you see here, if you change your lifestyle, I don't think it will come back. This is the jowl area, only one session with a concentrated mixture. You can see that there is this, it disappeared completely and improved the jawline and the mandible. In scarring, here in scarring, I don't add lipase, I only work collagenase. So here this is 4 sessions collagenase with fractional laser. You can combine it with fractional laser. Some people combine PRP with fractional laser. We combine collagenase with fractional laser. It gives marvelous, especially after cesarean section scars. It gives a great result. And this is another treatment. This is after only 2 sessions with collagenase without fractional laser. You can appreciate the major change. With acne scars, you can use collagenase, and this is only after 1 session. With acne scars, you can use collagenase with saline. So you don't. So it's about. It depends on you and the condition. You can use 2 lipase, 1 collagenase for double chin. Can I use it for the face? Yes, you can use it for the flanks, for anywhere in the body. It gives marvelous results. So in conclusion, you have to know that these recombinant enzymes were designed to be less immunogenic, minimizing the risk of side effects such as allergic reactions, no necrosis. This is very important. Lipase, not sensitive to hormonal regulation, is effective in any time. Collagenase promote the activation and proliferation of fibroblasts. It works on malfunction collagen and old collagen. And hyaluronidase reduces the fluid retention and facilitates the diffusion of the other enzymes through the extracellular matrix. One thing, there was a question here, said that after filler of the chin, the double chin was improved. This is right, because when you increase the length of the chin with a filler, so the fat under the chin will be redistributed again, so it will be less. So, but don't make this procedure after a filler, because the hyaluronidase will affect the hyaluronic acid injected. Thank you very much, and I hope to see you in Jordan.
Thank you very much, Dr. Medhad. Any question for Dr. Medhad?
Yes, please.
Yes.
Thank you so much for the informative lecture. How often you inject the double chin, like every 2 weeks or every 4 weeks? Because you show some pictures, like every 2 weeks, then 6 weeks, then 3 months.
Well, usually the protocol is to inject today, after 2 weeks. Then you can inject after 4 weeks or after 6 weeks. The first 2 with only 2 weeks interval. Then you can, it depends on the progress. And some patients say, I'm happy with this result, thank you very much. Some patients will need more. Some patients, they travel, because in Jordan, you know that in summertime, all patients come to Jordan. So we keep telling them, okay, when you come to Jordan, you will do like 3 sessions. When you come next year, you will continue your treatment.
Yes, please.
There is no maximum number. This is recombinant enzymes are very safe, but usually you do it until you achieve a desired result by you and the patient. But there is no side effects if you keep doing it every 2 weeks minimum.
Yeah.
How much per session maximum? And also, do you use it also for chubby cheeks?
Can you repeat the first?
First question, what is the maximum amount per session for the double chin? Second question, do you use it for chubby cheeks?
I will start with the second question. Yes, you can remold the face. You can use it everywhere on the face. And the maximum amount is you will use for double chin 2 vials of lipase with a dilution of 4 cc in each vial, 1 vial of collagenase, 1 vial of hyaluronidase. Now, if you want to inject cellulite, for instance, or if you want to inject stretch marks, because this is our other indications, but I did not mention in this talk here, you can use too many vials. So there is no number of vials, but usually we should not exceed a certain number of vials for each indication. In double chin,